We are going to start talking about the basic introduction of your EKG. So first, let's go through that cardiac conduction system that we talked about previously. The first one is your SA node. The second is your AV node. Then that conduction goes down to the bundle of His. You have your bundle branch, which branches off to the right and the left. Then you have your Purkinje fibers. So knowing how this works is going to help you understand your EKG and what is actually happening. So remember what an EKG is. Remember, this is a non-invasive visual presentation of the electrical activity of the heart. You have a lead system. There's chest leads and limb leads. You can have continuous monitoring and telemetry. It can show dysrhythmias, heart chamber enlargements, ischemia, and if there is any signs of an MI. Next, let's talk about some definitions that you're going to hear when we start talking about EKGs. First, you're going to have a wave. This is a deflection away from the baseline. This is a deflection away from the baseline. So this one is going to, where you have it's that wave is a deflection away from the baseline. A complex are several waves. So the complex are going to be what we see here. This is what your complex is going to look like. Then you have a segment. A segment is a straight line between a wave or a complex. So a segment is literally that straight line. An interval is a segment and a wave. Okay, so a segment and a wave. However it's going to be, you have your segments and you have your waves. So here are the different looks of what's going to be defined in your EKG. Now let's talk about the composition of an EKG tracing. First, you're going to have a P wave. The P wave represents depolarization of the atrial. This should be rounded with no peaking or notching. So the P wave is the first wave that you see. It should be rounded. Okay. Then you have your PR interval. The PR interval represents the time required for the impulse to travel through SA to the AV node. So what you're seeing here is the P, which is not very straight and pretty, but it's supposed to be perfectly straight, P. So this is your PR interval. So the P wave is just this. Your PR interval is all of this. Okay. Then you have your QRS complex. This represents depolarization of both the ventricles. This normally follows your P wave and is normally less than 0.11 seconds. So if we have our P wave, we have a line. This right here is our QRS complex. Right there. Then you have your T wave. Your T wave represents repolarization of your ventricles. This follows your QRS complex and is usually slightly rounded. It's not near as peaked as your P wave. So you have your P wave, QRS, and then a slight little T wave. right there. Then you have your ST segment. This is the time between ventricular depolarization and your repolarization. So you have your P, QRS, and then your slight little T. It's not very slight, but your ST segment would be this time slot right here before that T wave starts to ramp up a little bit. Then you have a U wave. U waves are not usually present, and it's usually seen in hypokalemia. So there would be after you have your P, QRS segment, you have your slight T wave, and then you could have a U wave that would represent. Said it not seen very often. Usually that is related to hypocalcemia. Next, you have your QT interval. The QT interval represents the time required to completely depolarize and repolarize the ventricle. So it's that whole time frame. So you have your P wave, QRS, and your slight T wave. So what this is looking is starting at your Q and going all the way over until you finish, I guess more right here, until you finish that T wave. An R to R ventricle reflects the regularity of the heart rhythm. It is measured from one QRS to the next QRS. So you have your P wave. Well, usually you have a little more line. Let me try that again. You have your P wave, QRS, slight T, then you have another P, QRS, to a slight T. And they're looking at one QRS complex to the end of another QRS complex. That is what that one is looking like. Here is a better breakdown of what I was trying to draw. It breaks down your P wave, QRS, your T wave. It does not show a U wave. Again, U waves are not very common, mostly seen with hypocalcemia. Here is what an EKG graph paper looks like. Just wanted to give y'all some information about what exactly you're looking at whenever we first come into class and start looking at these. You're going to see the different breakdown of your times. So you have a 3-second strip and a 6-second strip. These are not very long. You only have 3 to 6 seconds, and each little box over here you can see is 0.04 seconds. So first let's look at a basic cardiac EKG to look at how to calculate a heart rate. So how can we get a heart rate? By just looking at our EKG. First you want to get a strip that is 6 seconds long. So you have your first 3 seconds and then your next 3 seconds. So you have a 6-second strip. Then you're going to count each of your R waves. So up here, so this is your R right here up at the top. So 1, 2, 3, 4, 5, 6, 7. So we have 7. We're going to times that by 10. And we know that this has 70 beats per minute. The reason we use 10 is because if we utilize it for 6 seconds, but we need 60, so the reason we get 10 is we need 60 seconds, and we divide that by we only got 6 seconds. it's going to give us 10. So that is why we utilize the number times 10. So before we come to class, I want y'all to know what a normal sinus rhythm looks like. This is what a normal EKG strip should look like if there are no abnormalities. The heart rate should be between 60 and 100. The rhythm is regular. You always have a P wave before each QRS. The PR interval is between 0.12 to 0.2 seconds, and your QRS is between 0.06 to 0.12 seconds. This is going to be important when we start looking at abnormals. If we look at abnormals, these segments down here are going to start changing. So you need to know what a normal is. I got cut off there. So you need to know what a normal looks like before we come to class to start looking at your abnormals. Some things to remember. How does a conduction system play a role in your EKG? 2, you need to identify the wave forms found on a normal EKG. You need to know which wave represents depolarization of the atrium. You also need to know which complex represents the depolarization of your ventricle. You need to be able to describe the calculation of a heart rate using the EKG strip. And you need to know what is the most important assessment.